Carolina Health Information Exchange opt-out training. We're going to start by talking a little bit about what is the North Carolina Health Information Exchange, how is it set up, how is it meant to be used, what information is in the HIE. Then we're going to talk about the opt-out policy as it relates to patients. So the North Carolina HIE operates the statewide health information exchange in North Carolina, which is a secure, standardized electronic system in which providers can share important patient health information with each other. The use of the system promotes access, exchange, and analysis of health information, and it enables participating organizations to save time and reduce paperwork, facilitate more informed treatment decisions, and leads to improved care coordination, higher quality of care, and better health outcomes by providing health information about a particular patient across multiple providers. The North Carolina Health Information Exchange is North Carolina-based, so the Board of Directors are active and prominent in North Carolina medical community and represent a variety of organizations and interests. It is also independent and is not owned by any insurance companies, healthcare organizations, associations, employers, or government. The North Carolina Health Information Exchange is a nonprofit. It's also a private organization, and it is funded by many sources, including the North Carolina healthcare organizations and grants. There are multiple stakeholders invested in the North Carolina Health Information Exchange, including consumers, providers, payers, businesses, and government. So how does the HIE work? The North Carolina HIE's network combines information from separate healthcare sites to create a single virtual patient health record. So the patient health information is automatically pulled from a provider's electronic health record system, and it is standardized, aggregated, and then put into one universal patient record. That way, if you have a patient who is visiting multiple care providers who are on different electronic health record systems, they can come together to create one patient record that all of those providers will have access to. They can either access that information through the HIE's web portal or, in some cases, from directly within their EMR. So why use the North Carolina HIE? First, to have healthier patients, to have fewer medical errors by being more informed, to have improved patient safety, improved continuity of care, and better patient outcomes, to become more efficient with automated sharing of information, such as referrals, less paperwork, reduced time to access clinical information at the point of care, and fewer repeat tests and procedures if you can see that they've been done elsewhere. You'll have better informed treatment decisions by having a more complete and up-to-date patient medical record, and you support public health. So we do a lot of mandated or voluntary reporting to public health right through the HIE. An example of that is immunizations or cancer reporting. So how does this relate to patients, and why do they care? So from the patient perspective, their care is more coordinated, less duplicate tests and procedures, which cost them time and money, less paperwork for them to fill out. If you can pull in their demographics from another institution, you may not need to ask them as many questions, fewer errors and safer care, lower out-of-pocket costs if they don't have to have duplicated procedures or tests, and important health information is accessible when care is administered. So to kind of go over what type of information is in the HIE to be shared across providers. This is important information that you may be asked by patients that you treat. So in the North Carolina HIE network, there's patient identifiers and demographics, which include name, address, social security number, anything that you would use to identify that particular person, their encounter history, laboratory and microbiology results, radiology reports and images, adverse reactions and allergies, medication history, diagnosis, conditions, problems, immunizations, dictated transcribed documents can all be contained within the HIE, depending on what is provided out of that person's EMR. What's not in the HIE network? So we do not include any information created by a substance abuse facility or psychotherapy notes. Now, that's not to say that that information cannot get in there in the event that the medications for those conditions may show up if they're paid for by Medicare or Medicaid or commercial insurance. Visit notes from a non-mental health provider may include reference to one of these conditions or reference to one of those medications, and in those situations you would see that coming over. However, anything created by an actual substance abuse facility or psychotherapy notes does not come over. So this is a snapshot of what the HIE looks like. We do another training to kind of go into detail about the functionality and all the options and ways you can use the system. But this is a sample of what it looks like. You can see you've got this patient, John Cardinal's demographics here at the top, and then their allergies and alerts and encounter history, and all of that's going to be across all of the providers that John has that are connected to the North Carolina Health Information Exchange. And a little bit over here to the left, you're going to see a different kind of section where we sort the different information, so you can see the clinical documents, different laboratory documents broken out by what type of lab, some radiology information, and then even further left is really where the user of the system can navigate around, so they can access their patients, work lists, messaging, links, and all sorts of different functionalities that will be built into the HIE will all be over here on this left panel. So talk a little bit about security in the HIE. So connection to the HIE network is secured through the use of a virtual private network, or a VPN, and is protected by a dedicated firewall. And all access to the North Carolina HIE is password protected. Some organizations may facilitate access directly through their electronic health record, and under those circumstances, a new password is not required. We call that single sign-on. The data is encrypted at all times, in motion and at rest. Provider activity logs are audited by the North Carolina HIE, and patients may request a report on the access of their health record. They would request that directly through the HIE, and we would provide that to them. And users can only access patient information with whom they have a relationship, or in an emergency situation, physicians can access a record for a new patient. So the system will know if you are a provider who has a patient relationship, then it will allow you to access that record. If you have never had a relationship with that patient in the past, it will notify you that you've never accessed that person's record before. We don't have a relationship, and we'll ask you a reason why you're continuing on to access that record. And we do audit the reason given and provide that to the patient at their request. So the consent policy in the North Carolina Health Information Exchange, it's an opt-out policy, and what that means is that consumers are automatically a part of the North Carolina Health Information Exchange if their healthcare provider is a participant. So North Carolina law requires the NCHIE follow an opt-out consent policy, allowing patients the choice of not participating. And I'll get to that in a minute about how do they opt out. The policy was written with input from stakeholders representing patients, providers, employers, payers, and government, and consumers may opt out by mail using the opt-out form, or by phone. In the future, they will be able to opt out online from participating in the HIE. Consumers being patients. So state law requires that participating providers give the patient a state-approved form the first time they visit that provider location. We call that our patient brochure, and it kind of tells them all about the HIE and how do they pursue opting out. So this is the opt-out form here on the left, just a snapshot of what that looks like. So per North Carolina state law, participating organizations must give a patient brochure to all patients at the point of initial contact following connection to the HIE. Again, that form will talk about what is the HIE, what kind of health information is in there, and then it will direct them how to get an opt-out form if they decide to pursue that. And the opt-out forms will be provided by the HIE to participants. We have them directly on our website. We do provide a copy of that to our participating providers and organizations. If they want to print them out and give them to the patient, they can, or they can direct them directly to us. And we will also provide participating organizations a notice of privacy policy update to explain the HIE if they choose to use it. That's an optional, it's optional for providers to do that, is to change their notice of privacy policy. So how do patients opt out? What are their options there? So there are three ways a patient can opt out. They can opt out at the physician level. Health records ascribed to the physicians identified by the patient will not be a part of the patient's health record in the HIE network. So they can say, just my health record that was contributed by Dr. John Smith, I want to keep that out of the HIE. They can go all the way down to that level and do that. They can also do it by organization, so health records collected and maintained by the organization identified by the patient will not be a part of the HIE record for that patient. So they can say, everybody at Raleigh Family Practice, I don't want my health information coming out of that practice, regardless of what physician I may have seen there, they can do that. Or they can fully opt out of the HIE, so no health records will be made available in the HIE network across any of their care providers. So what does that mean? That really means that when you look that patient up, say they have fully opted out, and you look that patient up, you will not be able to access their record unless it's in an emergency situation. So we do still get the patient's health information. We just filter it out to general access, and that way we can continue to do the mandatory reporting to public health that we have to do, and in an emergency situation, you will be allowed to access that person's record even if they've opted out. And a patient can always change their mind in their opt-out decision, and they can rescind it, and they would do that through the HIE, filling out the same form as they did to opt out. So how to inform your patients? The HIE, when you come on board, will provide you with some tools and some guidance, but some of those things include talking points for all staff, scripts for the registration and patient relation areas, patient handouts. We'll give you a copy of the opt-out form, and then we'll give you plenty of patient brochures to make available to the patients. And we'll provide you with detailed FAQs, both on our website, and we'll send you something when you sign up, one that's geared towards providers and one that's geared specifically towards patients that you can share with them. And we're always available by phone or email to answer any patient questions that they may have. We prefer that if there's a question that you're unsure of, that you do give the patient our phone number and let us handle that question, and especially around opt-out. So we're going to talk a little bit about a sample go-live experience. This was in the state of Maine with their Health InfoNet, just to give you an idea of what one practice experienced when they went live on that HIE. They had a similar opt-out policy. So they had a primary care multi-site practice. They sent a mailing to 39,000 patients. This is a little bit above and beyond what we expect, but you're certainly free to do that. They mailed out information about the HIE to all of their patients. They got 62 calls in response. Of those calls, 26 of them were men, 33 female, 3 anonymous. Typically, the people who called were over 40, 61% of them being over 60, and 43 out of 62 opted out. So the total kind of experience there of that one clinic was that 43 out of 39,000 patients opted out, and that's when they were directly contacted with information by mail. You're more than welcome to do that with your patients, but at minimum, we would like you to just make that brochure available for when they first come into the clinic. So patient reaction, most patients, obviously, based on the last slide, have no questions and they choose to remain in the system. Some patients have a few questions that are answered in 30 to 90 seconds. This is what we would expect you to be able to answer based on the FAQs and the information that we give you and this PowerPoint. And they typically will stay in the system. And then you'll have a couple patients who have extensive questions and require extra time or a call to the NCHIE. For bullets 2 and 3, we're glad to help, especially with number 3. If you're getting a lot of questions, please send them our way. And if they do decide to opt out, we can do that with them on the phone right then and there. We estimate that only 1 to 5% of patients will opt out, so not a big burden on the HIE or on the providers themselves. So some common patient questions and concerns. What is the HIE and what is the point? I would say that the easiest explanation for what the HIE is really just taking all of that patient's information across multiple providers, putting it in one place in a way that a provider can look across that person's health history across all of their providers, make better treatment decisions, not order duplicate tests, save them time and money. Some common examples that we have provided with patients is a use case around emergency rooms. If they are in a part of the state that they don't live in and they need to go to the emergency room and that person is on the HIE, they can access their record from the other side of the state, their primary care doctor, who's their emergency contact, what medications are they on, what are their allergies, And in an emergency situation, that information can be pretty valuable, and that really helps explain what the HIE is and what is the point. So is my information on the internet? I think people are typically asking that question, and the idea of can it be searchable through the internet? And no, that's not true. So you can access the HIE through a web portal, but again, it's password protected and behind a firewall and heavily audited. And we kind of compare it very similar to an online banking situation where you can access that information through the web, but it's not readily available for anybody to look at on the internet. So is my information going to be sold? This is a pretty easy question to answer. The answer is just no, it's not. Again, to have access to a patient's health information in the HIE, you have to be a provider and have a relationship with that patient. And that kind of answers the last question is who has access to the system. So again, it's providers and their staff who have a relationship with patients in the HIE. Those are the people who have logins to the system, and that's it. So, we don't have access to go in and look at patient records because we don't have the relationship. We use a test system for that. No insurance company is getting logins to the HIE or anything like that. It's really for providers to use. So these questions are typically coming out of concerns of feeling that their privacy is violated, they don't trust that the system is secure, and they're worried that their information will be available to insurance companies, their job, or the government. And if you get these questions and you're not quite sure how to answer them, please send them our way and we'll be happy to help them out. This is really the end of the PowerPoint, but if you have questions, please send us an email or contact us via our website or whoever you're working with here at the HIE, and we would be happy to answer those questions for you. Again, you will receive patient brochures mailed directly to you from the HIE to put out in your lobby, and you can request more of those anytime. We have them in Spanish as well as English. And thank you for attending the webinar today.